Hospitals are running out of nurses, burnout is through the roof, and staffing shortages are hitting critical levels worldwide. In the US, 65% of nurses now say their stress is high, and only 60% would choose the profession again. The World Health Organization projects that by 2030, we'll be short 4.5 million nurses globally. It's a full-blown crisis. And now tech giants like Foxconn, NVIDIA, and Kawasaki are stepping in with a bold new solution, a collaborative nursing robot called Nurabot. This isn't some futuristic concept, it's already working in real hospitals in Taiwan. It delivers meds, patrols hallways, guides visitors, and takes over tasks that wear nurses down. It runs on powerful AI and advanced robotics, and early results show it could seriously ease the pressure on healthcare workers. A fresh national survey out of the US backs that up. 65% of nurses now say stress levels are high, and only 60% would pick nursing again if they had the choice. Those numbers are brutal, and they explain why hospital administrators are suddenly very keen on mechanical coworkers who never call in sick. Enter Foxconn's 3-computer strategy. It starts in the data center, home to racks of NVIDIA DGX supercomputers humming away on Hopper generation GPUs. These chips chew through petabytes of medical data to train foundation models, including FoxBrain, a large language model built on the NVIDIA NeMo framework. Think of FoxBrain as a kind of Alexa that speaks fluent medical jargon, handles text-to-speech, and even parses radiology dictation without blinking. Stage 2 is simulation. Hospitals build high-fidelity digital twins inside NVIDIA Omniverse, basically 3D replicas so detailed you can see where the IV poles sit. Omniverse pipes real-world physics into the scene, so robots can test routes, avoid collisions, and practice thousands of tricky maneuvers that would be risky on a live ward. Taichung Veterans General Hospital, or TCBGH, spun up a twin of its busiest nursing station. Then let a virtual Nurabot cruise the hallways for days before anyone touched a real corridor. Stage 3 pushes everything to the edge. Here's where NVIDIA Jetson Orin modules with 275 TOPS, that's trillions of operations per second of AI computing power, bolted inside Nurabot's chassis alongside NVIDIA Holoscan, a sensor processing platform that can fuse LiDAR, depth cameras, and 14 other streams of data in real time. Holoscan is the robot's nervous system, Jetson Orin is the brainstem, and FoxBrain acts like the prefrontal cortex, deciding what matters and answering human requests. So what does Nurabot actually do when its wheels hit polished floor? First up, medication runs. A locking drawer inside the torso carries blister packs from pharmacy to bedside, logging every handoff so dosage errors can be traced instantly. Then there's specimen transport. Little boxes of blood or tissue that used to soak up nurse time now glide along strapped to the robot's cargo shelf. Between trips, Nurabot patrols the ward, reading room number QR tags and pinging nurses if a monitor starts screaming. Foxconn's early time motion studies show that in day shift conditions, this single machine can shave roughly 30% off the distances nurses walk. Now the face. Yes, it's always smiling, and yes, it can feel uncanny on a night shift. But the design serves a purpose. Patients can spot the eyes from down the hall, and the LED mouth doubles as a status bar that changes color when the robot is busy, idle, or needs charging. Under that screen sits an array microphone that feeds straight into FoxBrain, so staff can issue commands like, "Nurabot, deliver wound care kit to bed 14," without touching a tablet. Behind the scenes, Foxconn's Hanhai Super AI Computing Center, rows of humming blue-lit servers nicknamed Hack1, handles continuous learning. Every shift, Nurabot uploads anonymized telemetry, wheel slip, obstacle maps, battery stats, even snippets of dialogue scrubbed with personal data. Engineers fine-tune the motion planners with Isaac Sim, NVIDIA's robotics training suite, then push fresh weights back down to the fleet before dawn. But robotics is only half the story. Foxconn's CoDoctor AI platform, also powered by DGX gear, is generating specialized models for vital sign monitoring, arrhythmia detection, retinal imaging, and cancer diagnosis. One standout is Coro Segmentator, developed using Monai's Auto 3D Seg, Monai meaning Medical Open Network for AI. a comprehensive toolkit designed for medical imaging. Feed it a cardiac CT, and 30 seconds later, you've got a color-coded, three-dimensional model of every major coronary branch ready to spin on an NVIDIA OVX workstation. Surgeons at Tung's Taichung Metro Harbor Hospital are already swapping screenshots in morning rounds, and patients suddenly understand exactly where the blockage sits. Video data is getting the AI treatment too. NVIDIA's AI blueprint for video search ingests feeds from hallway cameras, nurse stations, even door sensors, then uses graph neural networks to spot outliers, like a patient wandering or a bottle left in a path, and pings staff smartphones with a clipped highlight reel. Hospital administrators say the summarizer is saving hours of manual review every week and has already prevented at least one fall. Let's zoom back to Nurabot on the floor. During visiting hours, it turns into a rolling info desk, directing families to the right room without tying up reception. At night, when staffing ratios drop, the robot picks up slack tasks, carrying portable pulse ox sensors, fetching fresh gowns, or doing patrol sweeps that used to require a junior nurse in sneakers. That extra help means nurses get to spend the precious face-to-face minutes explaining procedures, or just chatting with anxious patients, instead of speed walking for supplies. And because FoxBrain is speech-to-speech, multi-language support is on the roadmap. Mandarin now, English next, Japanese and Bahasa after that. Once the model nails reliable face recognition, Nurabot should be able to greet a patient by name, recall dietary restrictions, and flag anyone who tries to follow it into restricted areas. Of course, healthcare isn't consumer electronics. Before a single unit rolls off the Taiwan assembly line, Foxconn has to check boxes for IEC 66161 electrical safety, ISO 13485 quality management, and GDPR-style privacy in every region. Taiwanese regulators fast-tracked the field trials, but Europe and North America will want hard data on crash testing, network security, and infection control protocols. Foxconn's answer is a modular design so hospitals can swap a damaged drawer in minutes, plus a LiDAR hard stop that triggers if anything comes within 20 centimeters at human knee height. The early user feedback is telling. Over at TCVGH, nurses in respiratory wards say they're clocking fewer aches after shift because Nurabot helps reposition COPD patients who normally need a two-person lift. Patients have nicknamed one unit Xiao Hu, Little Tiger, because the orange bumper stripes make it stand out from the scrubbed green walls. Meanwhile, administrative staff love the audit trail. Every delivery is time-stamped, geotagged, and signed off with a thumbprint scan, all searchable from a Grafana dashboard. Financially, Foxconn is betting that economies of scale, its bread and butter, will drive unit prices far below the six-figure service bots we've seen in small pilots. Analysts expect a leasing model. Hospitals pay a monthly fee that bundles hardware, software updates, and predictive maintenance, similar to how cloud vendors bill GPU hours. Jensen Huang took the Compex stage and called Nurabot physical AI in action, framing it as the logical counterpart to all the ChatGPT-style tools lighting up the internet. If large language models make sense of text, then robots like Nurabot make sense of the physical world, applying those insights where it counts on the ward floor. NVIDIA's Holoscan roadmap even hints at edge inferencing for ultrasound and endoscopy, so the same Jetson module could assist radiology in the morning and geriatrics at night. Meanwhile, outside Taiwan, hospitals are watching closely. The New York health system has already sent a delegation, and the NHS in the United Kingdom is evaluating digital twin workflows built on Omniverse to ease its own staffing crunch. Everybody loves the promise of 30% workload reduction, but what really sells the C-suite is reduced liability. Digital logs, collision avoidance records, and traceable drug custody. Still, skeptics raise good points. Robots can't do emotional support, and the learning curves for both staff and patients can be steep. Foxconn isn't blind to that. They're bundling onboarding packages that include VR training modules and 24/7 hotline support. Plus, every deployment kicks off with a one-week Robot Buddy program where a clinical champion shadows Nurabot to smooth any nerves. Where does this all lead? Foxconn's roadmap talks about exoskeleton attachments so Nurabot could help a single nurse lift a 90-kilo patient. There's RD on haptic feedback gloves so therapists can guide its arms during physio sessions. And once 5G SA blankets hospital campuses, edge compute could jump from 275 to 500 tops, opening doors to real-time pathology screening at the bedside. But even if those upgrades take years, the results so far are already shifting mindsets. Nurses who started out skeptical are now lobbying management for more units. Patients post selfies with the robot's permanent grin. And hospital planners, inspired by the digital twins, are rethinking corridor widths, supply room placement, and even elevator logic, so future facilities are robot-friendly from day one. Thanks for watching. If you found this breakdown helpful, hit that like button, subscribe for more on AI and robotics, and let us know in the comments. Would you trust a robot nurse?